Okay, then we have here the blood flukes. So basically, they try to inhabit here our liver and even your bile and your bile ducts, the gallbladder as well. So it includes here the genus Fasciola. We have also here the Clonorchis and we have also here the Opistorchis. So first we have here the Fasciola hepatica. Other name for this one, this is your sheep liver fluke, also called Fasciola California, the stoma hepaticum. We try to cause here your sheep liver rat. We have also human liver rat, and we have also here your fascioliasis. Okay, the first intermediate host here would be the snail, which is your Limnaea philippinensis. And we have also here the second intermediate host would be your water vegetation, belonging to your watercress, water blade, water grass, and even here your kangkong. So we have your specific na species here of your water vegetation serving as the second intermediate host. We have here the Nasturtium officinale. Okay, for the morphology of the adult, such as adult worm here is a flat with the typical na shouldered appearance. So makikita, so very prominent itong shouldered appearance niya because of the cephalic cone or your conical projection. The testes is described here as highly dendritic and tandem formation, so side by side. And we have also here the ovary is loosely coiled. So again, this fascial hepatica try to inhabit here our proximal bile ducts and even your gallbladder and even your okay even your liver. And for the ova, so the ova of your fasciola hepatica, again, this is unembryonated, unsegmented, and oviposition. So would have the characteristic na hence egg appearance with a typical broad, very broad na operculum. And it's ovoid in shape. Okay, then we have here the life cycle of your liver fluke. This is applicable here not only to your fasciola hepatica but as well as to your clonorchis and even with your opistorchis. So you get infected by this one through the metacercaria present in the second intermediate host. Okay, the second intermediate host here would be the water vegetation, mga grass or blades or watercress. You get infected by ingestion of that containing the encysted metacercaria. One is trying to eat that second intermediate host. The metacercaria will go to your MES and eventually try to go to your try to exist in your bloodstream. I try to exist here in the small intestine, and after that one existed the metacercaria try to circulate your body, try to break your blood vessel wall, penetrate your bloodstream, and eventually it could migrate to other part of your body. And it tried to migrate in the liver, and from there, it tried to go to your bile duct and gallbladder, where you could find here the adult worms. And an adult worm here try to lay egg. The egg will be released here in your feces, unembryonated or unsegmented. And then the ova here or the egg will embryonate in the water and try to release here the miracidium. Then the miracidium try to infect your first intermediate host, which is your Limnaea philippinensis. Inside the body of your snail, in the first intermediate host, the miracidium will develop here to become sporocysts, developing that one to become your regia and eventually developing to become cercaria. The cercaria will be released out of the body of the snail. It swim in the water and try to find here the second intermediate host, which are your water vegetation, where try to insist to become your metacercaria. Okay, we have here the pathology. This is pathology related to your Fasciola hepatica infection. So the first one, we have here the presence of the larva, the migrating larva, try to cause here trauma, a traumatic and necrotic lesion in our liver, causing here the liver cirrhosis or liver damage. Basically, try to infect our liver parenchyma. Another one in adult found here in the bile ducts. It's try to crowd in that area and try to invoke here inflammatory reactions resulting to your edema. We have also here your fibrosis. In the case of your heavy infection, so that would result here to your liver damage in the form severe manifestation of your liver damage in the form of your liver cirrhosis. Then we have here the Halson pharyngeal fascioliasis. It's a type of infection where you try to eat liver coming from the other animals infected by this parasite. And the liver coming from that animal, you eat that one, contains the adult worm of the Fasciola hepatica. So you will not able to notice that na meron siyang adult worm. And therefore, once you try to ingest or to eat that one, the adult worm try to attach to your pharyngeal or your pharynx area. And therefore, try to crowd in that area and try to cause here asphyxiation or suffocation. So, hindi ka makahinga. Then we have here the false fascioliasis. So, this is characterized here by the ingestion of the liver containing here the ova of your Fasciola hepatica. So, liver coming from other animals, for example, or meat products here. So, the liver of that contains here the ova. So, if you try to ingest that one, that ova will pass out in your gastrointestinal tract and pass out as the ova as is. And without an actual infection, because again, you get infected by not the ova, but you get infected by the metacardia. Only that you accidentally eat or ingest a liver containing the ova, so it will pass out as ova as remain as ova. You will not get infected by that. So to clear that one with the presence of your false fascioliasis, then your patient should be given here 3 to 4 days of liver-free diet. So pag nawala ng ova sa stool ni patient, it would signify here that the cause of the presence of ova is coming from the ingestion of the liver containing the ova and not actually the patient is not actually infected by your fasciola hepatica. Okay, before we go to the next species here with your liver fluke. So we have here the fasciola hepatica adult worm. Okay, the oral and the ventral sucker for that would have here the equal in size. Okay, the next one, we have Clonorchis sinensis. Other name for this one is your Chinese liver fluke, also called here as your Oriental fluke, or your, we have also your Oriental liver fluke, and we have also Lancet liver fluke. Try to cause here Clonorchiasis. Okay, the first intermediate host, again, is a snail belonging to the following genus. We have here Bithynia. We have also here Paraphossalorus, and we have your Bolinus phociana. And the second intermediate host here would be your fish in the form of your cryptonoid fish. For the life cycle, again, the life cycle would be the same as your Fasciola hepatica. Okay, for the morphology, the adult worm is also flat with a transparent integuments. And then the oral sucker is much larger compared to the ventral sucker. Again, in your Fasciola hepatica, oral and ventral sucker are all equal in size. But here in your Clonorchis sinensis, the oral sucker is much larger compared to its ventral sucker. For the testes, this one is deeply lobed in tandem formation compared with your Fasciola hepatica, which is your highly dendritic in tandem formation. The uterus is also the same, loosely coiled pa din siya. For the ova of Clonorchis sinensis, on the other hand, is embryonated, matured, segmented upon oviposition, whereas your Fasciola hepatica is unembryonated. Okay, so we have here the description for the ova of Clonorchis sinensis. This is old-fashioned carbon filament light bulb, wherein the operculum side of that is characterized here without shoulder or ring. But on the opposite side, doon sa baba niya, meron siyang comma shape na aboperculum. Okay, then we have here the disease pathology related to your Clonorchis sinensis infection. So it try to cause your liver cirrhosis, liver damage in the form of your hepatomegaly, liver inflammation. And we have also here cholangiocarcinoma or cancer of your bile ducts, associated here with the cholelithiasis or the gallstone. Okay, the next one, we have here the Opistorchis felineus. Other name for that one is your cat liver fluke. So cat liver fluke here, so I mean to say, its definitive host would be the cat, or even foxes, or even hogs, or even dogs. And humans serve only here as our accidental host. Okay, try to cause here the disease Opistorchiasis. Okay, the first intermediate host for this one is your Bolinus tentracolata, which is another snail. And we have also Bithynia. And the second terminated host will also be cryptonoid fish, the same as with your Clonorchis sinensis. Okay, for morphology, the adult worm is also flat and would have here tapered anterior, rounded posterior, the same as with your Clonorchis. Only that, ang pinagkaiba, the ventral sucker of your Opistorchis is much larger compared to its oral sucker. Again, in the case of your Clonorchis, it would have bigger oral sucker compared to the ventral sucker. In the case of your Fasciola hepatica, both the oral and the ventral sucker are of equal size. For this one, the testis is dendritic, only that they are diagonal to one another. So, dito, sa kailalim mo isa. Whereas, in your Fasciola hepatica and Clonorchis sinensis, ang testis niya ay ganun siya. Okay, in tandem. Ito naman is diagonal dito sa kasababa. And for the uterus, again, it will have here still loosely coiled na uterus. And adult worm here most likely similar to Clonorchis and much larger in size compared to your Clonorchis. For the egg of your Opistorchis, just like your Clonorchis, is also embryonated, matured, segmented on oviposition, whereas your Fasciola hepatica is unsegmented. Yun ang pinagkaiba nilang tatlo. So here the egg would have here a narrower tapering and pointed ends. It would have here less conspicuous na operculum ring. Okay, so